I'm Clifford Sussman, MD. I'm a child and adolescent psychiatrist. I've been in private practice in Washington, D.C. since 2008, and I specialize in treating patients with internet and video game addiction and other screen-related problems. I got into this because I was a gamer myself. I grew up playing lots of video games and even learning to program and design them. And then when I went into practice, working with a lot of teenagers and young adults, and even some younger kids, parents would come in and tell me, hey, my kid's addicted to video games. And even some of the young adults would say, hey, I can't stop playing and I'm dropping out of school. So, I started to realize that, this was often a chief complaint. And then when I would actually evaluate the patients, I would find that they had a lot of the same problem behaviors that I would see in my addiction rotations in training. So I started to do a lot more research on the brain and how it's affected uh, by excessive gaming, and that's how it all started. And I've stayed in it because I've treated a lot of patients with these problems, and I've developed more and more uh, techniques for it. Um, I use a lot of psychotherapy that has been developed for treating people with addiction, like motivational interviewing, and I find it's very helpful. I find that there's a real shortage of clinicians who are able to treat internet and video game addiction. There's probably even a shortage of clinicians who can recognize it. In fact, a lot of the patients who come to see me will say that uh, they had already been to several psychiatrists who said that their problems were caused by anxiety and depression, and kind of missed the fact that they were on screens uh, for 10 hours straight or for entire weekends or entire nights. And a lot of the patients I get are dropping out of school, or they're stealing money from their parents to play video games, or to upgrade their video games. Some of them are just living at home in their parents' basement, not launching. So it's a really big problem, and it keeps growing, and the pandemic has contributed to it as well. So the demand for clinicians keeps growing and the supply is limited. And that's why not only have I continued to treat these patients, but I've also tried to expand my career into education and trying to train other clinicians. Clients seek treatment for gaming often because they have dropped out of school, or their life is falling apart in some way or another, directly related to not being able to get off their screen. So I see all sorts of problems. And it's really the problematic behavior that results from excessive screen use that defines the addiction. So, so at least for clients, especially young adults who have the insight that they're having these problems in their life, that's what brings them in, wanting to change those behaviors and those problems most of the time. Often there's also this sense of um, hopelessness, like they're trapped in the virtual world, or some anxiety or depression that maybe they're escaping from. Uh, Oftentimes, they just feel like their life has become kind of meaningless, at least their real life, and they feel like they don't really have a purpose, or they feel unfulfilled. Oftentimes it's the parents coming in and saying, my kids are addicted to games. They're not, their grades are dropping. They're staying up all night. They're not sleeping or eating. And it's not just games too, it's social media. It's being on their cell phone all the time, being on Netflix, being on YouTube. And with some older kids, I'll see, and some young adults, and some older teenagers, I'll see, continued social struggles because of all the developmental stages that people usually go through in adolescence. They're all being disrupted, and so often they're having trouble with relationships. Often They feel kind of lost in the real world, and they only really feel comfortable in the virtual world. They're often socially withdrawn, and the pandemic has kind of added to that situation as far as the patients who've been seeing me recently. And a lot of them are also very physically out of shape. There's maybe I'll get very overweight patients who are gaming all the time, or I'll see the opposite where patients are malnourished because they're gaming instead of eating. In many cases, because gaming has become such a social thing, because games basically are social media now. There's very few people who do single player games nowadays. It's mostly multiplayer games. Uh, the role that games play is often their primary social life of my patients. It's a way to connect with people everywhere and maybe compensate for the disconnect that they might have socially in the real world. In fact, for many of my patients, the social aspect of gaming levels the playing field for them because they may have weak social skills. They may have high functioning autism. And when they're on a screen doing their socializing while playing a game, not only might they have mastery of the game that they don't have of socializing, but they also don't have to look at um, facial cues or nonverbal cues. What role does gambling play in the life of some who struggle with gaming? This is actually a really excellent question because there's a lot more overlap between gambling and gaming than people realize. In both a literal way, because you can gamble online and you can play games online for money. Um, any card game, for example, that's for money. There's an online version of now, so people are literally getting addicted to online gaming, perhaps instead of casino gaming. It's much more instant access to the action. And everybody who has an addiction is looking for, instant access. They're looking for instant gratification. So in many ways, online gambling is even more satisfying to that need for gamblers than going to a casino. But also, in a neurobiological sense, there's a lot in common between gambling and gaming, and one of the reasons for that is that one of the reasons that they affect the brain in a similar way uh, is because they both provide instant gratification. Both gambling and gaming, um, and the other reason is, and perhaps a bigger one, particularly for gambling, is that they both provide variable ratio reinforcement. Now, that's a behavioral concept introduced by psychologists like Skinner, and you see it at a slot machine. What it means is that instead of getting a reward each time you pull the lever at the slot machine, you get it at a random interval of time. So you never know when you're going to get a reward or not, and that's what keeps people doing it, and that's what makes it harder to stop doing it. If you got the same reward every time, more like a vending machine, and you knew exactly what you were getting, it wouldn't be as addictive. So gaming companies understand this principle, and they put layers upon layers upon layers of variable ratio reinforcement in their games, which is something I like to talk about in my presentations. So why is it important for behavioral health counselors to screen for gaming disorder? Gaming disorder has only recently been started to gain official recognition uh, and consensus across various fields of medicine, particularly with the World Health Organization's official recognition of gaming disorder as a diagnosis, and the DSM-5, including it in their conditions for further study. Specifically internet gaming disorder. I'm hoping that with time that will expand to include a much broader definition. But even with that definition, going by their criteria, there's a huge amount of of people out there who are suffering from those criteria, from those symptoms. There's a huge amount who meet those criteria. It's a greatly underdiagnosed and undertreated condition. Few clinicians have had training in how to approach it, and it's important for behavioral health counselors to screen for it because it can cause so many problems in people's lives. It can be the reason people are dropping out of school, or the reason that they're failing to launch, or it can be the reason. It can be a contributing factor to anxiety and depression. And it's particularly important to screen for it because even if it's not the primary problem, or even if it's mixed in with a bunch of other psychiatric or psychological issues such as anxiety and depression, often you can't get at treating those other issues, and you can't have successful treatment until you've addressed the addiction, the screen addiction. So even in cases where there's a lot of underlying issues to the screen addiction, those issues may not be addressed until the screen addiction is dealt with. So here's a few of the key issues I look for when I'm assessing for gaming disorder. I look for how is the gaming and the time spent on games and the inability to get off games affecting their social lives, right? Like their social functioning, their ability to maintain relationships, to make friends, to reach out and to other people, to initiate conversations, or are they socially withdrawn? I look at how it's affecting them academically. What are their grades like? How has gaming changed their grades, if at all? What's their academic status or their career status? Have they lost jobs because of it? I also look at how it affects their family relationships. And I look at how it affects them psychologically. Are there things like anxiety and depression that they're using games to escape from, creating a vicious cycle? I look for health issues. Are there physical problems that are being contributed to by excessive gaming? So, can excessive gaming affect a young person's development? Excessive gaming can indeed affect a young person's development, and I've seen it start at a younger and younger age. So it's important for a clinician evaluating for gaming disorder to understand the normal developmental milestones of each phase, and to look at how they're doing, and to see if gaming has been a contributing factor to any developmental issues. For example, the a large percentage of my patients are young adults and teenagers. So it's really important to understand the developmental milestones of adolescence. So you'll see teenagers who are having a tougher time joining with their peers, or their all their relationship with their peers is done online. And they have this fear of missing out, where they do all their socializing on social media, and they're not learning to have regular face-to-face conversation with their peers. So, what goes on in treatment for gaming? There is a lot of content that I can share with you on this, as far as what goes on in treatment for gaming. So typically, I'll have, if it's a child coming in, I'll have the parents meet with me separately and give me a history, and then I'll assess the children separately, so I get both points of view. And then often what I'll do is if I've determined that screen use is a real problem, I'll recommend something like weekly psychotherapy for for the kid, individual psychotherapy, and I'll also do some separate work with the parents working on interventions and balanced parenting and setting limits and what are the appropriate developmental transitions with screens. And with the teenagers themselves, as I mentioned earlier, I'll put a big focus often on motivational interviewing, but I'll also use techniques which are found in psychodynamic psychotherapy, cognitive behavioral therapy. There's a real value in group therapy, although there's a real shortage of it for treating gaming addiction. So that's something that I'm hoping there will be more of, and it would be a bigger part of treatment if we had more resources for it. Sometimes because I'm a psychiatrist, I can prescribe medications either to treat the comorbid problems, or I could use something such as Wellbutrin, which has some mild evidence supporting it reducing gaming behavior, excessive gaming behaviors. Just to add for what goes on in treatment for gaming, I was sort of sharing my personal experience as what I do as an outpatient provider, but a big part of treatment for gaming is often to recommend higher levels of care than outpatient for people who are really unable to get by on outpatient treatment alone because their problems are too severe. So there's inpatient treatment like Restart, like Karen Renaissance for young adults. They have a digital addiction track that I helped consult for. There's IOPs, there's partial hospitalizations, there's different facilities for aiding in a dopamine detox or a digital detox, such as the Wilderness program. Although I would also add that any digital detox should be followed by a very thorough plan, because if patients have a detox and then go back into the same setting that they were before with the same environment, they have a very high chance of relapse. So why aren't there more professionals doing this work? Well, it could be because it's not part of our training. And this is a big reason why I went into this, because it wasn't part of my residency training or my fellowship training as a child and adolescent psychiatry. It wasn't really touched upon in medical school. So that's one of the reasons I've dedicated myself to training other professionals. And I actually have an online clinical training that's available now at the Escape Center, which I helped develop, which is electronic screen compulsion and addiction professional education. So there's courses that you can take online. There's also trainings like this one, and I do a lot of webinars, and I do a lot of them for professionals. You can find out about all my presentations and all my webinars. You can even get access to past presentations and articles I've written in other forms of psychoeducation that's not just for patients, but also for professionals on my website, which is www.cliffordsussmanmd.com. I have a link to a review article that I published in one of the ACAP journals. So there's actually a page on my site for professionals, and it's also a great way to sign up to be on my contact list. So once again, that's www.cliffordsussmanmd.com.